anyone who's taken Pfizer or Moderna or Johnson and Johnson, and I recommend the first two to take over Johnson and Johnson. That's a personal preference, though. It's about if you want to get a second shot, right? Um, but I will say, anyone who's taken it hasn't died as a result of taking of having COVID after that.
Let's learn how our next guest gets up, dress up, and show up on purpose. Enjoy the episode. Hello, morning enthusiasts. Welcome to the Best Morning Routine Ever podcast. I am your host, Lunide Lewis, and today it is my honor and a privilege to introduce a very kind man to the show, Ethan Walls. He is one of the most knowledgeable thought leaders on the topic of healthcare administration. He has served as CEO of one of New York's largest medical partnerships. His vision is to redesign healthcare in a way that will not only protect patients but empower physicians and other healthcare workers, especially this time, right? Especially during the pandemic. So I'm looking forward to hearing his insight on how we go about doing so. So he has a new book, The Mega Factory of Healthcare. He sheds light on the practices of every medical group, doctor's office, hospital, and urgent care centers in the country, exposing the truth behind our complicated healthcare system and the steps we can take to fix it. So I am excited to jump right in. Ethan, welcome to the show.
Thank you for having me. This is really exciting.
It is a delight. So, you have an extensive background in healthcare. You've been in it for decades. So, I want to learn so much right now. But let's get into your story. Like, what's your journey? How did you get into it?
So I started my career working at a time in the finance world when they were digitizing around the turn of the millennium.
Mhm.
And so I was there for a lot of the digitization that happened, and it was an exciting time. I worked at a large financial firm for 7.5 years,
Mhm.
and wanted to branch out and do some consulting, and I had bad timing. It was right before the downturn, and like a lot of people, I had to refocus and start a new career. And I went into healthcare. I went and worked for a startup for electronic medical records company, and startup culture, entrepreneurial culture was great. I love the the ability to do everything in the company, to be involved in every aspect of the company. But I really needed to have more regularity in my the economics of my life. So
Mhm.
I went and took a full time job doing electronic medical record rollout for the large partnership in New York, and moved up in the company. I ended up being a COO of the company and took them out of their previous management company and built a management company for them, which I was CEO of for 2 years. We built a foundation, we built a national brand, we doubled the size. It was a great accomplishment. And then over the last year, I've been doing a lot of COVID related things and helping different companies with vaccination programs, testing, and schools and community organizations helping with reopening.
Yeah, that well-versed background. You you reinvented that whole company. You helped them so
That
much at
was,
that time.
yeah, yeah. And it was great. It was a great opportunity, and now I'm with the book. I'm trying to educate people on healthcare and have them understand the lexicon of what healthcare is and how to engage with it.
Yeah. So tell us about the healthcare and the pandemic, how the impact it had on just the first responders. You're talking about doctors, nurses, and you know what's being done about it countrywide.
So I think that, there's been various stages of the pandemic. For everyone personally, they probably had a sourdough phase. They've probably had a crafting phase. Uh, in healthcare, we've had different phases, right? The first phase was the initial lockdown and figuring out how to save lives,
Yeah.
and how to keep people, who were becoming less stable.
Mm-hmm.
And so it was just a fight for life at the beginning of this, and that takes a mental toll, right?
Yeah.
That you're dealing with a lot of death at the beginning, and thank God we're not dealing with as much death now. We've been literally saved by the rollout of the vaccine,
Mm-hmm.
but it's not necessarily over. We're still having a lot of cases of vaccine hesitancy all over the country, and we need to get everybody vaccinated. I was vaccinated several months ago. I recommend everyone to get vaccinated as soon as they can. Don't wait. That's the best advice I can give. Um, so look, it's been varied, right? Many offices shut down. People delayed health. People delayed surgeries. A lot of the last 6 to 8 months has been catching up on those things that people delayed in their lives, and so I always talk about a physical exam. When was your last physical exam? For some people, it could have been 2 years ago.
Yeah.
And many things get checked at a physical exam. So go and get a physical exam. It's very important.
Mm-hmm. For the vaccine, I know I just got my first shot as well, and
Congratulations.
thank you. Waiting to get my second one in 2 weeks. And tell us, there's a lot of people who are hesitant to doing it because it's so new.
Yeah.
There's the uncertainty. There's not much research, much data. So how do we all ease that pain? And I know that's the case, especially in the Black community. So how
Yeah.
can we ease that uncertainty to encourage people to go out and do take the shot to some because it's here to save lives.
So look, I look at it from this perspective. The first thing is that the normal process takes many years because they need participants who are involved in trials. And in this case, there were not a lack of people who raised their hands to be part of a trial for a vaccine that would save the world. And so, from that standpoint, I think that it's that we've accelerated because of that.
Mm-hmm.
The other thing to take into account is that the drug may be new, but the science isn't new, and the science of mRNA
Yeah.
is pretty established and is safe.
Yeah.
So we really have to understand that these are really two important factors in weighing a decision to get the vaccine. The last thing to consider is that anyone who's taken Pfizer or Moderna or Johnson and Johnson, and I recommend the first two to take over Johnson and Johnson. That's a personal preference, though. It's about if you want to get a second shot, right? But I will say, anyone who's taken it hasn't died as a result of taking of having COVID after that,
Yeah.
right? There's not hospitalizations really after that. It's mitigating the seriousness of this disease. And that is the biggest indicator for me. We've lost too many lives already
I
to
agree.
COVID.
I agree.
We've lost, and if this saves one life, then we should take it.
Yeah, and I like that you said the science hasn't changed. The science is not new because we did it for polio. We did it for the flu shot. We're doing it over and over in the years, and that is it's good to hear that the vaccine is new, but it's applied science, right, to a new virus, to a new
Absolutely.
disease. And so I'm glad that it's working. My father-in-law was actually part of the person who raised his hand and said, I'll be part of the study to help be monitored over a period of time so that we
That's
know
great.
that it's working. And so
Thank you.
thank you. Thanks to my father-in-law. But
Yeah, thank him.
it's the little things that are being put in place initially just to save lives, and it's becoming so accessible.
Yeah.
As well. Now, question that is in a lot of people's minds, and I actually did ask my nurse this: is this going to be annual?
My guess is it's going to be rolled into the flu shot yearly, and it will probably be something annual. The scary thing is, and I don't mean to scare your listeners at all, but this is only the first time this happens in our lifetimes, and it probably won't be the last. We've gone a very long time since the last global pandemic, and our world has gotten much, much smaller. And so, we need to remember this could happen again, and we need to be cautious and understand that there are certain healthcare measures that need to be put in place when these things happen. It's not political. It's not attacking any one part of the economy. It's a healthcare measure, and that's an important thing.
We definitely got to be better prepared for sure. It took us by storm last year. This was in 2020, and we government wasn't ready. Nobody was ready
Nope.
for what went down, and it was so abrupt. It just happened so fast. The shutdown, everything, and then the death toll kept increasing. I remember one time it was half a mil within a month in California, and it was just like, wow. It puts things in perspective how we gotta prepare for this stuff. I think we did get uncomfortable, the economy as a country, saying, "Oh, this hasn't happened in a while," so we didn't prepare for it. But I have to say we've taken some drastic changes in adapting as human beings,
Yeah.
as the human being that we are.
I think the scariest thing for me is that all the public health officials were very worried about the fall last year and in 2020, and much of their predictions were right, and that people didn't listen was scary to me. And politicians made this about a political football rather than science,
Yeah.
which was scary.
So I have to ask on this topic. I took the Pfizer one, and there's the other two. What's the versus? Let's do a versus between the three.
Okay, so the efficacy of Pfizer. Well, Pfizer was the first, and it's probably got the best efficacy, but it's also got the most data. Israel, the country of Israel, did extensive studies and gave Pfizer all of their data on all of their patients in their country that took it, and so they've got really good information on it and really good data on it. Moderna came very quickly after, and it's got very similar efficacy. I think the biggest difference is that you have to wait an extra week until you get your second shot. But again, we're talking in the 90 percentile of being able to get COVID after getting these two shots. Johnson & Johnson's is a single dose. The efficacy is much lower. But again, as I said earlier, you really you're not getting hospitalized if you get this vaccine and get COVID after it. And the other thing to point out is that the number of people who've gotten COVID after they've gotten the vaccine is really low. I mean, you're talking about maybe 6,000 people out of hundreds of millions. That's a very, very low percentage.
It was like 5%, 5% chance that you may get it.
Yeah, it's like a 5% chance that you may get it, but like the numbers are not even getting up to that amount, that percentage amount, based upon the number of people vaccinated and then the number of people who got breakthroughs. But the biggest difference between, if you group Pfizer and Moderna together, which need to be high cold storage, and then Johnson & Johnson is the one shot versus the two shot, and then the efficacy. If people ask me which to get, I would say Pfizer or Moderna over Johnson & Johnson if you can get it, because your protection of COVID is even higher after your first dose of Pfizer and Moderna than possibly than Johnson & Johnson. They're just looking at that stuff now.
Okay, that's interesting, and it's the beauty is it's free, so the government has made that it's available and accessible for everyone, so you don't have to worry about paying it. And for me, and just a question is, how does that work? Being in the healthcare, now we're going to talk about healthcare and debunking some of the stuff with healthcare and the truth
Yeah.
behind healthcare. How does that work in terms of funding this kind of stuff?
Right. So you just gave me a trigger word. The vaccine is free. The vaccine is not free. But
Yeah.
let's be clear.
I figured that much.
It.
Somebody's paying for it, and where's the money coming from, and how is it being done? So let's get real.
Right. Somebody's paying for it, and it's your taxes that are paying for it. So the U.S. government is paying for the vaccine and then distributing it to the states. That's the first thing. But the real challenge is who is paying for the people who are there vaccinating you. And those are through contracts with cities, states, municipalities, even the federal government. And so then you go back to, okay, who's paying for that? And again, we're talking about huge money going into the pockets of many people who are running those programs, not necessarily people working at those programs. And so, we have, one of the companies I'm working with, we've done some private partnerships with companies who wanted to bring tenants back to their buildings. And so they're paying us to have a vaccine clinic in their building for their tenants, right, at a commercial office space. Yeah. The cost of vaccinating people is very high. And so we shouldn't take for granted the fact that when we hear it's free. What?
What's a ballpark?
The ballpark, it could be anywhere between $50 and $150 per shot.
Okay.
Now we're talking about 200 million people in the country.
Right. Yeah. It's steep.
It's steep. And that's just on the administration. I don't even know what the cost is to the government. But I do know that the stock of Pfizer and Moderna have not gone down.
Yeah, and those companies are ahead of them. And so to the rest of us, it looks like it is free, but the government is putting money in these pharmaceutical companies to make it accessible to us. And then in the return, we got to pay for that. We don't pay for it now. It's like it's accrued with interest.
Yes, it is. Yes, it is.
It's scary. And so that's one of the truth, right? So enlightening us with some more truth about the healthcare industry.
Yeah, but when your house is on fire, you're not worrying about the cost of putting out the fire. You're worried about putting it out. I think that we're at the point where the fire's almost out, and we're like, holy crap, how much did this cost me?
Yeah.
And we're not talking about that enough. We're also not talking about personal responsibility of certain people who are not going to get the vaccine. We're not seeking out places to get it done and are homebound, and the cost of reaching out to them. Yeah. I mean, there's certain states that are incentivizing people with lottos or with tickets to things or money to get to get vaccinated, and so the cost keeps on going up because of that.
Yeah. And it's save lives. It's here to save lives. So I see why the effort is going towards that. It is costly. I mean, those people are sitting in those clinics and they're empty. You know, the personnel that was saying the county is paying for, they're there 8 hours, 5-6 days a week, and they're compensated, and no one is coming for shots.
That's right. And so what we've seen is that places like New York City are going away from the mega sites to smaller sites, to in local communities where they can have a higher impact. So you're vaccinating less people in a day, but you're in a place where you can hit more people who may need it and are unwilling to travel for it.
Yeah, no, absolutely. Thank you for sharing that. I do see a lot more microsites in the San Diego area as well, in the community centers.
The challenge is going to be in the fall or winter, are we going to require every kid in every school to do it like we did with polio? When the polio shot was approved for children, every school child got it in a day at school. And, are we going to let politics get in the way of doing that for the COVID shot when it becomes available to be given out, probably in the fall or winter?
How can politics get in the way?
Oh, politics can get in the way of anything. politicians have reasons why they don't want things happening, and if they don't require it, right, to be vaccinated, and if they aren't sitting in schools getting it done, people aren't going to get their kids vaccinated necessarily.
Right.
I think that you should have one day in the winter after it's approved by the FDA where every school child in the whole country gets vaccinated on one day. We'll have more than enough supply to do it. 3 to 4 weeks later, everybody can get their second shot, and then you'd be done. And you know, what a magnificent way of showing how we've come together as a country if all the kids got vaccinated on one day.
Right.
But the reality is that probably won't happen.
But in the fall too, that's like flu season. So that's what we experienced that happened last winter, right? It was lifting at the end of the summer, and then kids went back to college, and then it went back up. The rate went back up. So flu season, it's almost like you can look at the past data and make an inference. Okay, this is possible. Once those kids are back, the school's open, and they're heading back to school. So it would be in the best interest to do this. The FDA, they must be scrambling and pulling their hair out, trying to get this approved at this short time frame.
Yeah, I think that they don't necessarily scramble. They just do what they have to do, right? But they are moving as quickly as they can. It's interesting to see how quickly they've moved throughout this whole process.
That's good to hear. Very good to hear. Tell us a bit about your book.
So my book really takes the veil down on the world of healthcare, how it works, how we got to where we are now, gives suggestions for people who want to get into healthcare, where they should look. Healthcare has become a huge factory. I talk about a number of controversial subjects like Medicare for all. And I kind of go through the economics of how it doesn't really work. You know, you think that flipping that switch would be great. The problem is, what are the ancillary things that are attached to healthcare that would go away if we went to a single payer system, and how many jobs would be affected by that, and what would that do to the downstream effect? I mean, if you look at it in 2007, 2008, the car companies had, during the downturn, had really horrible reactions in the market and had to be bailed out. And they talked extensively about when a car company fails, or a car company has to remove a line of cars, right? And they get smaller, what the economic impact is to the country, because the supply chain downstream are all affected by the little decision or big decision to not make a car anymore. You know, it's the people who are supplying the parts to the car, and then the people who are the janitors for the company that's supplying the parts, or the restaurants around that, or the gas stations along the road where the truck drivers are stopping to get gas and get food. You know, it's on and on and on. And in healthcare, we've done very similar things, right? We have an economy that's been propped up around healthcare, and what will happen if we remove that from the economy? Is the savings on healthcare going to make up for the loss in jobs and revenue that's streaming into the economy right now? Who knows? Probably not.
Yeah, it sounds like an interesting read, and we'll put that the title of the book in the show notes, so our listeners can have access to find out more, and to find out what are the steps, 1 or 2 steps that you say that can help fix the complicated healthcare, because you outline where people can look if they're getting into the healthcare industry. What's 1 or 2 that else they can consider?
First and foremost, own your data. Know what your data is. Know what you're looking at when you're looking at things. I help teach hopefully, how the economics work of this. But own your data, own where your data is going, understand who's seeing you, even the corporation that's behind the company that's seeing you and the doctors that are seeing you. Understand that the doctor may not be an entrepreneur, may be working for somebody else, and they may not have an effect on what your bill is going to look like. I make a bunch of suggestions at the end of the book. One of them is around price transparency. Another one is around lobbying, healthcare lobbying. I think that is like lobbying in any industry has been the downfall in healthcare, and it's hurt us more than helped us. Every time the government gets involved in healthcare, something else goes wrong, and doesn't matter if they're Republicans or Democrats, everybody's screwing it up. So I'd like to see more more involvement by entrepreneurs. I'd like to see more involvement in the market giving solutions rather than the government giving solutions.
Yeah, especially if there's a lot more entrepreneurs being birthed, right? A lot of new ideas, a lot of new people are becoming freelancers, and so that changes the whole dynamic of benefits coming from corporate America as well. So there's a lot to consider, a lot to think here as we move into this new era.
Yeah. And I'll tell you, I think that this is a perfect time. If you're someone who is an entrepreneur and you want to start something, healthcare is extremely local. And healthcare isn't just about in its purest form, it's between a provider, a doctor, a PA, a nurse practitioner, and a patient. But in reality, healthcare is a whole lot of things that doesn't have to do with that. It's the social determinants of health that can help somebody be healthy without that interaction with a provider of care.
Well put. So tell us, Ethan, what's your morning routine like? How do you get up, dress up, and show up?
My morning routine. So I most of my life have not been a morning person. So I got to get up and I got to shower. I got to take that long hot shower in the morning and
wake you up.
Wake me up. Right. And then for me, these days it's really getting the kids out of bed and off to school and get them dressed. Many days I have to go in early, so I'm jumping in the car early, but I've been trying really to be present with my kids in the morning and get them on the bus. Unfortunately, it's a lot of yelling to get people going to wake them up. I should throw them into a hot shower, but they don't like to shower. So that's how I get up. And then over the past year, I spent more time having coffee with my wife and having a little
intimate time with the family. What are you reading? What are you consuming in the morning? How are you getting in your peak state before hopping in the car and heading off to the office?
I usually watch the news when I wake up. I turn on the Today Show, or I turn on the news to see what's happened overnight. I'm checking email from overnight. I'm checking Twitter and Instagram and Facebook to see what's been commented on, what people are talking about. I usually hold harder news stuff or articles for throughout the day when I have a couple minutes. And
that's just to keep you in the loop in the healthcare, to see what's happening on the world, the news, because that's your nature, your work nature, the nature of your work.
I try to consume most of that throughout the day.
Mm-hmm.
But in the morning, I'm looking at the broader themes. And, in my old profession, there were broader themes that would derail a day.
Yeah.
And so if I wasn't prepared for that, then I couldn't be my best self.
Gotcha. All right. So tell us, how can we connect with you? Where can we find your book?
You can find my book on Amazon. It's called The Mega Factory of Healthcare. And my name is Eitan Walls. It's linked to it through my website, strongwallsconsulting.com. And you can reach me at etanwalls@gmail.com.
Excellent. Awesome. We'll put that on the show notes. It has been a pleasure. Thank you for sharing with us the ins and outs of the vaccine and how to actually go about it and how much it really does cost. And so the benefits of getting it. Really appreciate you coming on the show today, Ethan.
Thank you for having me. This has been great. I really appreciate your time.
It's been a pleasure. Hope you enjoyed today's episode. Please comment and tell us what was your favorite part, your favorite habit that you are going to try out for yourself today. Comment below. If you haven't already, be sure to subscribe. Until next time, I will see you at the top of your best morning routine ever. Stay blessed.